but not least, I have the honor to invite Mr. Bernard, who's been here with us. And Mr. Bernard, air pollution or the right to clean environment has recently been included as a human right by the United Nations. Many organizations work on human rights and the environment, but very few have linked this to the exposure to air pollution as well. And the people heavily affected by air pollution are usually the poor, the marginalized sector of society, although it affects all of us. But longer exposure to high levels of air pollution as more vulnerable populations might be living closer to corridors or roads and perhaps don't have air purifiers, which in many cases is financially out of reach for a lot of the population. So we'd love to hear a little bit more, as if you could elaborate on how the UN Special Rapporteur on human rights and the environment and how this relates to policymaking, in particular for air pollution control. So over to you, Mr. Bernard.
Thank you so much for that very comprehensive introduction, and thank you all for allowing me to speak here. I'm more from a human rights and environmental law background, so my background is not focused on air pollution in of itself. But I can give you a brief overview of what we have seen in the research that have come out. And that is that following a brief improvement in air quality during COVID-19, Asia is once again, including Thailand, the epicenter of ambient air pollution. Air pollution in the region is a health hazard and represents the highest risk for premature deaths. According to 2019 data, air pollution accounted for about 6.75 premature deaths annually, including deaths of more than 600,000 children. Furthermore, 90% of all people live in places where the air quality fails to meet the guidelines established by WHO, amounting to a violation of the right to health and adequate standard of living. Air pollution has also resulted in costs that extend far beyond health, including social, cultural, and economic costs. The UN Special Rapporteur on Human Rights and the Environment, Dr. David Boyd, argued that poor air quality or persistent poor air quality has implications for a wide range of human rights that all of our countries have signed up on, including rights to life, health, water, food, housing, and an adequate standard of living. Persistent air pollution and poor air quality clearly violates not only those rights, but also the right to a healthy and sustainable environment, which is now being increasingly recognized in constitutions as well as at the international level. Additionally, acid deposition, for example, indirectly affects the right to food and water due to pollutants damaging impacts on agricultural productivity. While the General Assembly and other international bodies has adopted numerous resolutions on the right to clean water, they have never really adopted a resolution on clean air. However, both are essential to life, health, dignity, and well-being. And even the UN High Commissioner for Human Rights stated that there can be no doubt that all human beings are entitled to breathe clean air. Beyond this, air pollution affects everyone, but it disproportionately impacts the most vulnerable, of course. Among the most severely harmed are women, children, the elderly, minorities, indigenous people, and members of traditional communities, and also people living in poverty. Children are, for example, uniquely vulnerable due to the adverse impacts or due to their psychological, behavioral, and environmental factors. Their developing brains and bodies are exquisitely sensitive to toxic substances. Also, just note that the overwhelming majority of illnesses and premature deaths caused by air pollution affect people mainly in low and middle income countries. For instance, major sources of ambient air pollution, including power plants, factories, incinerators, and so forth, are often located close to poorer communities. At the same time, their socioeconomic status inhibits this group from accessing information, healthcare, and other resources. I heard from one of the panelists that there is a lot of data, but the problem we have is also translating that, the so-called interesting or the very useful data to populations that may not understand scientific research. Furthermore, the Special Rapporteur asserted that states have duties relating to promoting education and public awareness, providing access to information, ensuring freedoms to participate in environmental decision-making, assessment of proposed projects, policies, environmental decisions, and ensuring affordable and timely access to remedies. I just want to quickly stress that there are several aspects to these so-called procedural rights, where not only should we make these data available to different populations, but also that they should be monitored and assessed, as well as assessed to give people an overarching, let's say, insight into the risks they face. Thank you so much.